So yes, that's going to go, I think. Got it. Okay, so thanks, Marty. Oh no, that's not you. Somebody emailed me back. So thank you everyone for joining us at the Irish American Heritage Museum in Albany, New York. We are about to start. We're just waiting for 2 more speakers to join us, but I'm delighted to welcome. I'm Elizabeth Stack, the Executive Director of the Irish American Heritage Museum. We're delighted to have at the moment with us Mardi Moore, who's the Executive Director of Out Boulder County. It's an LGBTQT intersection plus organization that has been on the ground with that group and an inclusivity drive for decades. I forget, Mardi, when you were started, but you can tell us. And then Padraig Kirwan is a oh yeah, sorry, we're going to be in I just want to silence myself there, yeah. And then Padraig is teaching in the London College of Economics.
No, I mean Goldsmith, Elizabeth.
Goldsmith,
University
yeah.
London,
and
sorry.
oh, here she is. Sorry, I just have to send another speaker the link. So Padraig works with Dr. Leanne Howe, who will be joining us shortly, on intersections between the Choctaw and the Irish during the Great Hunger. So we're going to talk about, the history of kind of suffering and loss and how health issues in the past have affected those communities. Sorry, I'm a little bit frazzled because there's emails coming in from the 2 speakers who are trying to log in. So we'll begin very briefly, and then I'll introduce the other 2 speakers when they join us. We're supposed to have Francis Sengabo too, who's from the Albany Refugee and Immigrant Services Centre here. So if he's able to come in, we'll integrate him into the conversation. So we're delighted. I just wanted to say the reason we're doing this is because we got a grant from basically from an amalgamation of sources, the American Alliance of Museums, the CDC, the Science Museums, and it was one of the first kind of initiatives of its kind in the country where they're trying to promote the fact that museums especially and libraries are one of the most trusted sources in America at the time. So they're leveraging the position of us to try to help in a particularly localized area with access to the vaccinations. And I will say most cities, and I'm sure it's true for all of our panelists, have had, huge open clinics and all of that. But given the variants and kind of the urgency that's happening, they reached out to these networks of museums and libraries in an attempt as well, I think, to kind of contextualize and maybe try to dispel some of those myths. So our series is, oh good, somebody's in.
It says Mardi Moore, but I swear I'm already here.
I know. Well, we don't know who this other Mardi is. It might be because I sent the link again that you had forwarded. So someone has just come in. You have to unmute yourself. Good. And I'm going to make you.
It's me.
Oh, it's Leanne. Okay, great.
Sorry, I know you guys are pulling your hair out. I'm sorry.
No, don't worry.
Over.
So we're delighted to welcome you. That's Dr. Leanne Howe, who, as I said, has done amazing work with Padraig on the Choctaw and the Irish, and she's the Edison Distinguished Professor in the Department of English at the University of Georgia in Athens. So we'll just wait for Francis we won't wait for Francis, we'll get going. So I wanted to ask you guys, and we might start with you, Mardi, just to give everyone else a second to breathe and get settled. When the pandemic hit first, if we can remember back to those shocked months in kind of January, February, but I know for us in Albany it was March. We closed down on March 12th. How did your community in Out Boulder County, how did it affect them, and what was the initial reaction?
Elizabeth, thank you. And what a great group of people to spend an evening with. I'm very impressed as you've been making introductions. And thank you to everyone for listening. We closed down in March also. So I'm the executive director of an LGBT group, all those letters, where they group sexual orientation and gender identity into one group, and they think we're homogenous, and we certainly are not. And so in that, there are all kinds of intricacies to think about when we're talking about the pandemic, and then we're talking about vaccine and recovery. But I will say that prior to the pandemic, the LGBTQ community had suffered from greater isolation, If you look at the social determinants of health, we score poorly. Before we started the session, Elizabeth was talking about the refugee community and the fact of that folks working in service industry jobs and having to be exposed to the pandemic and then losing jobs. A great portion of our community also lives in poverty and have frontline service level jobs. So they were impacted at that level too. I will say that we at Boulder County secured funding. We had never given out direct aid dollars to our community before. And we secured funding from government sources and from foundations, and we did pass-through grants. I was writing checks as fast as the money could come in. We put together a system for people to apply, everything from trying to stay housed to paying for car repairs to get to a job they needed but were afraid to go to, and on down the line. And we stayed in lockdown. God, I lost a whole year in there, and I don't think that's uncommon. As we all talk about when things happen, there was this weird space and time thing that happened to us in this. But I don't study that, but I look forward to the report of somebody who does. But in that time, the suicide rates, the mental health rates suicide rates going up and mental health rates crashing. And so at the tables that we have been at for over a year, I have been saying to folks, we are facing two pandemics. We are facing a mental health crisis and COVID-19. Public health seems to have caught up with that somehow. In the state of Colorado, Children's Hospital has said the number of youth, like really young kids, attempting suicide and harm through all of this has skyrocketed. And so, that's the reality of kind of what we went through. We held people together. And then when the vaccines became available, word of them, at least in Colorado in December of that year, whatever that year was, we got to the table and started talking about vaccine equity.
Okay. Thank you, Marty. That was amazing. Leanne, are you ready? Would you like to discuss how it affected your group? Yeah.
Thank you for having me on this panel. It's good to see everybody. Hey, Padraig, how are you?
Hey, Leanne, good to see you.
It's good to see you. I apologize for being a little late this evening, Elizabeth. I finished up with another panel. So it's a busy time. I think it's because this is Native American Month in the US. And so
yeah.
We're happy that people are interested in what's happening to American Indians. As you all know, I'm Choctaw from the Choctaw Nation of Oklahoma, although I work at the University of Georgia. And our communities have a long history of working with, working against pandemics, starting in the 1736 year was particularly hard on Choctaw people. And we know this from the reports and the voices that are in the archives from that period of our history. Measles, mumps, smallpox was an early pandemic that wiped out. If we had 70,000 people in the lower Mississippi Valley, probably by the turn of the 18th century, we're down to somewhere between 19 and 20,000. They were constantly taking our temperatures and what our population status was at that time. So if you all have looked at the early history of pandemics in the United States, and North and South America, there are a lot of good texts, and an early text is their number became thinned. So I can recommend that book. But during this pandemic, that the tribes have been practicing due diligence in during this pandemic, and vaccinating some and very high number of people, somewhere in the 80% of our population has been vaccinated, amongst the Chickasaws, Choctaws, Creeks, and the Cherokees. So part of that is a history of fear from aberrant strains of everything. I remember our people died by the thousands from things like measles and smallpox. So the tribes in our Choctaw Health Center is especially vigilant about putting out the word on our radio station, on our website, our chief talking about it, people lined up to get vaccinated because we know what the effects have been on Native population since the Europeans began coming to the United States, or what is now the United States. So I want to say that I'm really proud of my communities for taking this pandemic so seriously. Indian Health Services across the country, but especially those that are provided by the nations themselves, have been practicing due diligence, masking, and the vaccinations themselves. So I'm here to report some good news.
Yeah.
About our communities at home. Thank you for having me.
No, we're delighted, and I had remembered earlier on today that it was Indigenous Peoples and Native American History Month, so I'm delighted we were able to. And of course, Veterans Day, and today is also, funnily enough, the anniversary of the death of Typhoid Mary in 1938, and she was the first person, an Irish immigrant, but the first person in US history to be identified as an asymptomatic carrier, and a super spreader.
That's right.
So, Frances, I'll just welcome you, but we'll give you a second to settle in. Frances is with the Refugee and Immigrant Support Services of Emmaus Incorporated here in Albany. He came from Rwanda under refugee status in 2007, and he's spoken with our centre before as we talked about vulnerable populations. So I'll just give you a second, Frances. Thank you for joining us, to settle in and to kind of catch up. We're just talking about back in January, February and March, then when we finally closed in 2020, how the communities were affected, initially. But I'll just kind of pass it off to Padraig to give you a second to settle in. And Padraig, or Padraig, is the senior lecturer in the literature of the Americas at the Department of English and Creative Writing in Goldsmiths in University of London. And for those of you who were on earlier, he was at UCD at the same time as me, and we're trying to figure out if we sat in the same tutorials. So welcome, Padraig, and thank you.
Thanks.
So you can tell us, he works with Leanne a lot on this, but so you can discuss London if you would like, or you can weigh in on, we talked a little bit as we were preparing about those shortages, on the reservations at the start, and how it kind of brought back up, because at the time, a lot of the donations were coming from Ireland, and it was because people were happy to kind of pay back to the Cherokee debt through to the Choctaw tribes. So you can probably take it away.
And the Navajo.
And the Navajo, yeah. Thank you. Mm-hmm.
That's right. No, it's great. It's great to be here tonight. It's great to be back with Leanne, and be talking to you, Elizabeth, and to be here with Mardi and Frances and everyone who's listening. So thanks a million for the opportunity. But yeah, so I suppose for me it's really interesting. I mean, obviously I'm from Ireland, thinking about the pandemic back home, living here in London, major international city, very different responses to it in terms of governmental approaches between Ireland and the UK. I'll come back to that in a second. But also, as you said, of course, I've been very fortunate to collaborate with Leanne for a number of years. And my original research and my first study in UCD back in those days, when I was doing my PhD, was into Native American writing and Indigenous literature. So yeah, for instance, you've mentioned the Hopi tribe, and as Mardi is talking about the LGBTQ community and some of the challenges that are faced disproportionately by different populations, that, you know, so much of that chimes with and kind of ties in with what we see happening in, for instance, in the Hopi Nation, where, you know, 3.5 times more people who are American Indian or Alaska Natives have COVID, you know, in the early stages of the pandemic. Also, there are higher rates of, say, for instance, obesity and heart disease amongst many of the communities. And there's kind of a greater, if you like, a disproportionate sense of disease burden in the first instance. And of course, then from talking to people amongst the Navajo community and the Hopi, you also see then very often access to running water in some cases, electricity, even the internet. These things are harder to come by. So all of those challenges face.
Oh, you've just frozen, Padraig. It's not me, right?
Yeah.
No, okay, good. Okay, we'll come back. Francis, it sounds like there's a lot of parallels in what Padraig was talking about with, you know, what your own centre would have gone through, or people that you work with in RISE. Can you talk to us a little bit about, you know, oh, you're back. Okay, good.
We come back.
Oh, I'm back.
Yeah.
Sorry.
Yeah, you're frozen.
So I'm not sure where I dropped out there. Did I freeze at some point? But so all these all these great things are happening. But from in terms of being here in London, in many ways it was quite a kind of cognitive dissonance between hearing stories back home in Ireland. I distinctly remember when the pandemic was in the very early stages in February and March. Mary, my wife, happened to be back in Dublin, and we were heading into lockdown. I'm sure most people here will remember the Taoiseach at the time, Leo Varadkar, was in Washington, D.C., and he made this, at the time, it seemed to be almost a kind of it was taken by some media to be a sensationalist announcement. He was a visiting dignitary abroad, and he took this decision to close Ireland down, to say that society was going to shut up and we were going to stay at home in order to protect ourselves and protect one another. And that's exactly what we did. And at the same time, here in the UK, of course, the approach was manifestly different. And we know now from the House of Commons report that was released about a fortnight ago that the British government and Boris Johnson, as Prime Minister, had invested in a herd immunity policy. And it was quite simply a case of, I think one quote that has come out, you know, whether it's apocryphal or not, we're not entirely sure, but Johnson may have said, "Let it rip." And the kind of the lack of, I suppose, safeguarding and the lack of care, lack of masking that Leanne mentioned earlier on, all of these things definitely, you know, had a huge toll. And I think in the early stages, just to see how various communities are approaching the pandemic was in some ways heartbreaking, and also, you know, unsurprising by times perhaps, but also a huge education for us as well. So yeah, I kind of felt uniquely placed to be in touch with various different kind of, you know, friends and collaborators at the time.
Well, I think, Padraig, both you and I being immigrants, you know, in another country, of course, not able to go home. America has only opened up on the 8th of November, the travel, you know, so people haven't been able to come in to visit us, or we haven't been able to go back. And that, again, Francis, with the Refugee and Immigrant Services, like that whole idea of lockdown and still like an essential worker, you know, so I know from speaking, you speaking with us before, you know, a lot of the jobs that people get through your centre, like, are, you know, cleaning or stacking shelves or what were deemed essential workers. And so they're very vulnerable, and they're very already maybe a little bit marginalised because of language barriers and stuff. And then here they were in a pandemic, expected to go work, you know. So can you speak about your community for us? And welcome.
Yes. Yeah. You know, specifically for refugees, it was confusion, where first of all, the language barrier, because all communication was in English, they could not get the right information. Secondly, it's the size of families in the house, where generally majority of refugees, they are from 5 to 10 in the same house, a little house. So during the pandemic, it was really, really confusion. Or they say, you know, no 3 or 2 people in the house, and now there's a family for 10, 11. So it was a really confusion. However, because the majority of refugees, they were working on front line, like cleaning, in the restaurant to deliver food or to cook or do this and this in Walmart. It was hard because two things. One, they were scared to say that they're affected or they have some symptoms, because they're feeling that if they get symptoms, next day they will not be able to come to work and they lose their income. That's one. Second, it was if it said that has symptoms, maybe test positive and has to be in quarantine, where and how. Mm-hmm. Those were the two scenarios that was very hard for refugees.
Yeah.
The first thing we did is to educate them, to tell them, if you have these symptoms, talk to your employer. Again, it was a barrier language, but I was able to go with other volunteers to go to tell employees that this person, they're not able to work because of this. To apply for unemployment. Also, it was another issue. It was online, and some of them, they have low skills in the computer or no skills in the computer. It was a very hard until some of them start to get unemployment around in July. It took a long time to get. Mm-hmm. For kids, they didn't go to school. Now it was online, all classes. I can tell you, our children, they didn't get anything. Right. Because they lost skills, no one who can show them, even volunteers who could go to help them in their house, they could not go there because of guideline of CDC. But the good news is that little by little, and also as you know that it stopped other refugees to come in the country, to travel. It was hard. They don't get visitors, but some follows refugees. They were in refugee camps, they could not come. But little by after 1 year, they're opening little by little. Now is good because of the guidelines of the CDC and the State Department for the newcomers. Now they have to go through, they get training before coming in the US, and after getting here, they get another training, orientation, how they can, and they're recommended to get vaccination. While others who were here, it was hard to know, even when vaccine came, I'm not sure if you get those fake information. Yeah. That is how the chips, there's something wrong, people, they will die, something like that. So for refugees, it was a really scary. They were devastated, they don't know what to do. But little by little, they get educated. Now, now like our center, we do not accept anybody to come in the building if the person is not vaccinated. Mm-hmm. That's one principle. We don't even allow them even to come on the window. So now, for that, our next door is a CVS pharmacy. They provide vaccination. So that is good. Mm-hmm. In the beginning, as you know, where the vaccination was online. Again, no computer, no skills, how to schedule. And if you are going to schedule, so who will drive you there? Because there were no walking. They were only to drive in. And majority of people did not have cars. It was a very confusion, but right now, as I said, with newcomers, at least the guidelines are clear. People understand what the first step, next step, until they get all vaccination, and they can go back in the community. That's where we are now.
Good. Well, yeah, I mean, Padraig kind of touched on it too. The political response, was so varied across the three countries, with England, Ireland, and America, and then of course, states differed here from the federal government, and so it has. But even cities within states, had kind of their own policies. So it's kind of worrying. Mardi, historically, when you talk to us about LGBTQ issues and medicine and that kind of, what was the response, when the vaccinations came out there, and how does the community view maybe vaccine mandates or that kind of thing?
So I feel like I'm the Forrest Gump of organizing. So sitting in my basement where I'm sitting now, and I sat for a year and a half, we had gotten ourselves in Colorado. There was a historic flood in Boulder County in 2013. And out of that, there had been some work done that had gotten put in place because mountain communities of color, they didn't recover like the other communities. And through study and work, those findings were, some of the results of those findings were put in place, meaning that as the pandemic hit Colorado, the government invited a variety of people to the table to help plan. So LGBTQ communities, Spanish-speaking communities, communities of color were invited into these tables. Because we were there, the vaccines were coming. One of our board members was there and said, would it be helpful if we did a survey to find out if what LGBTQ people think about the vaccines? And they said, oh my goodness, that would be such a gift. Well, it ended up being the study in the nation, which I think, Elizabeth, is why you and I even connected. The U.S. News and World Report picked up on that. After our results, Kaiser Family Foundation and the Human Rights Campaign did studies. Our findings were similar. But in that, we realized that there are, particularly in people assigned female at birth, cisgender women, that there was some great hesitancy about the vaccines. Those findings remain to be true early on. I don't know, we haven't done a follow-up study on that to see what we're seeing, but that would be true. So we started doing some things around that to address some of those concerns. So there was greater hesitancy than straight cisgender people, lack of trust in the government. One of the things I mentioned before we started streaming this is, so I came of age during the AIDS pandemic. And the fact that government systems still do not ask the optional question around sexual orientation or gender identity beyond the binary makes my hair go on fire. So we lived through a pandemic. The fact that they can't get themselves in line enough to capture that information. So we don't have any studies. We know we've helped vaccinate 19,000 people through our equity clinics. But I don't have a starting point and I don't have an end point, nor does the government. And so this is a problem for all of society if we're leaving large populations out of data sets. But there's great hesitancy. So one of the concerns for gay men in particular is that I've been living with AIDS for 30 years and you haven't come up with a vaccine. And now what seems like in Project Warp Speed, their branding people didn't do us any favors. We now have this vaccine, it's safe, it's effective, and you should get it today. There was some real hesitancy around that. When Francis was talking and the barriers, those are the barriers we've been dealing with. I think those are universal barriers for communities that have been marginalized. Transportation, only in English. We have a large Nepali community in Boulder County. They finally, what the pandemic's been going on forever, they finally have one piece in Nepalese. So the public health has challenges. We work with great public health people. They have made some great adjustments, but public health is not built for everybody. And that is true in the LGBTQ community. So to deal with the hesitation, we received money, funding, started using some of our political power and set up vaccines stations that were equitable. And working with El Centro Amistad, the immigrant community, undocumented people face the same challenges that trans folks face. IDs don't match, don't trust the government, don't have transportation to get there. They're all drive-up clinics, but you don't have a car. I mean, that thing was, oh my God, that was ridiculous throughout this. And you can only do it online. So, and some of that stuff continues. They haven't, nobody has pivoted to improve a lot of that stuff. So we set up clinics, and man, we made them gay. We had flags, we had a photo booth, we were giving out stuff, swag. We were celebrating it, trying to encourage people, come have some fun. We'll be here. We'll work with the clinicians so you don't get misgendered going through. We'll have people speaking Spanish. And so we set all those up, and that's how we helped 19,000 people get vaccinated. We only know a portion of the people who were truly LGBT, because initially they didn't have any system for registering people. And I'm like, give me the link. And so they gave us the link, and we just started devoting staff time to reaching out to people and registering them ourselves. As public health finally got their feet underneath them and were able to do larger clinics, we lost track of that data. So we can just do some best guesses around the 19,000, but that's who went through the clinics. So there's some real hesitation. Why should people trust the government? Up until the 70s, people who were gay or lesbian were classified as mentally disabled. I think there was even stronger language until 1972. Trans people are still in the DSM. Gender dysphoria is still, listed as a mental disorder. So why would you trust a government that already sees you as faulty? I mean, there's a lot of ground that needs to be made up. We're hoping that we're making up some ground in Colorado. It's not public information, but it is now. We're going to run a bill. We're going to run a bill that is fairness in data collection, which is optional, just like race and ethnicity is, to check that box. So will sexual orientation and true gender identity. But the government needs to start seeing us so we can deal with the next pandemic a little better.
Mm-hmm. Well, Mardi, I mean, that last comment, unfortunately, you probably are right, like that this is not going to be, and that's not, veering into kind of conspiracy theory grounds. Like there will be more pandemics, and the science has indicated that this one was coming, and so that's kind of the fear, I guess. And you've all touched on that, what do we do in a world where you need a car to go to a drive-in clinic, or you need a computer to register online on a thing that crashes? And so, how are we going to, particularly, I think, for communities amongst us that are, underfunded or underserved, to try to get that fixed up? John Oliver did a thing a couple of weeks ago on the misinformation that was being targeted specifically, right, to different communities. A lot of the time, English is a second language community. And so, Spanish Twitter, or, Twitter and Instagram in different languages, or Facebook, that's where they're getting this kind of, corrupt information. Leanne, was there that in the native communities, do you think, like misinformation or the distrust, of government?
I think that I would answer it like this: yes and no. Why? Because we have long, as a nation, we have our own communication networks, our own newspapers, radio stations, and I think we're very adept at moving from online to we have a health line that you can call. So the issue for us, of course, we have some of the same issues that all of you had. We don't. So we don't necessarily. I'm just going to say it. We don't trust the federal government to do much of anything for Native people in the United States. Thank you very much. You almost tried to wipe us off the face of the earth. But we trust in our tribal governments. So the tribes really stepped up. We have our own hospitals that the Choctaw Nation funds our medical community network system. So we have doctors located, for instance, in my hometown in Ada, Oklahoma, the Chickasaw Nation run the hospital, and that's where I go. Even though I'm a member of the Choctaw Nation, I have my card and that's where I go. So we cross immunize each other's people too. So the immunization is not just for Chickasaws or just for Choctaws or just, we're involved in trying to keep the health of our community because we are surrounded by non-natives. So you've got to help them as well. They are welcome to come into our clinics as well. So I don't think, for instance, that there are just vaccine people who will not take the vaccine. And, you know, we're still working on them. And some of those are members of my own family. No way, I'm not going in, you know, to even if it's a Choctaw nurse, I'm not going in. Okay, we need more talking to you about what this is going to be like if you don't. And so that's some of the frustration that I have is people in my own community even not trusting our own hospitals. And to me, that's sad. And it just it boils down to educating the public. So you can see it in our newspapers and online. Come in, this is this is safe to do. Not everything has been safe that, and so I think that is one of the things that we tackled. It's trying to make our communities, help our communities understand this is so important for the health of our people. And pretty much I have to report, it has been working. So the Choctaw Nation has been good to reach out to other communities as well. And again, that's just working together. We've had 150 years to try and do this, and with non-Indians and Choctaws, much less our other communities. But I'm happy to say that other tribes have been doing the same thing. We have to help people help be helped.
Yeah. And, I think what was surprising, in one way, when you look at the historic reaction of Padraig, maybe you can talk to this a little bit, and I'm not going to put you on the spot about dates or anything, but, there was absolute uptake in the smallpox vaccine, or polio, certainly, and particularly in America, polio, but like in Ireland, we lined up to get vaccinations at school. You didn't question it. If you traveled abroad, you lined up and you took whatever shot they told you, Da Nang fever, like where were we going, and now in the last, 5 or 10 years, or maybe 20 years, it's coming, the disinformation and the mistrust is coming from the left and the right, and so there's this kind of health thing that, well, we don't know what's in it. And there's a right wing of, well, we don't trust, or what are they doing with us? I mean, your phone is tracking you. I don't know that they need to put a chip in you, And so was that apparent in England as it was certainly here in America, or,
I mean, it's really interesting. And I think what you're saying there makes perfect sense, Elizabeth. And it's such an important point that you're trying to parse the idea of where the skepticism comes from, where the hesitancy comes from. And when Mardi talks about all of those issues, I mean, it's very clear in some ways where the skepticism comes from. It comes from disproportionate effects that are felt, socially, economically, culturally, by various different communities who have been treated and mistreated terribly by successive governments over many generations. So when we see the effects of the fact that the British government failed to close society down adequately in the first instance, that led to a huge disproportionate death of people in the BAME community. It led to a huge disproportionate death of people who were in the fifth quintile, the lowest groups, the poorest groups in the UK. So obviously, by the time the vaccine arrives, if you're thinking about a buy-in, as you phrased it earlier on, who buys into these things? Well, for instance, if you've been working at home, if your salary has been untouched, if you've lived in something of a COVID bubble and you've been able to protect yourself, then you may perhaps have some greater faith in the system. But of course, if the system seems to you, to all intents and purposes, to be broke, then you probably won't. And I think all of the points that Mardi touches on, the things that you know, for many people, the privileges that we have, the fact that we can drive to a vaccination center and so on, for a great number of the population, those things aren't there. And that's a huge issue. Now, interestingly, in the UK and in Ireland, 9 out of 10 people have been vaccinated at this point in time. So the vaccine take-up has actually been quite huge. I'm kind of, it beguiles me in some ways. I know exactly what you're saying about Ireland. There's that notion, and what Leanne is touching on there too. I think the idea of a small community, and perhaps in Ireland there is a sense with a small island nation of 6 million people that we have a representative government that perhaps does represent us. We very often know our local TDs, for better or for worse. We know people within our own communities who are health workers. We know people who, for instance, in the small villages where you and I grow up, doctors, and you know, all of society went to the same primary school. So we don't have that kind of sense of disenfranchisement, maybe to a degree. And I think that definitely promulgates a greater sense of trust in many ways within not only kind of government systems, but also social systems and social networks. Which isn't, of course, then to say that in Ireland we don't have pockets of deprivation, we don't have many of the same kind of challenges. Here in the UK, I think in some ways, and this gets really interesting, and Leanne and I've spoken about these things earlier, I think in many ways, for better or for worse, I think the British government's failings in the first instance, that's not my opinion, that's, as I say, in the House of Commons report, that there were substantial failings. I think in some ways those failings meant that there was a huge rush to get the AstraZeneca vaccine up and running, because the British government realized very quickly that was going to be their only salvation. And of course, what happens in that moment too is we also see Brexit coming into the mix. So we have a really kind of interesting discussion, and historians like yourself in 20 years' time, and perhaps if we ever see a release of government papers, or when we get to that point where we learn more what happened. But we see that unfortunately, in some ways, the vaccine program became, and Mardi touched on this too, warp speed in Trump. You know, you kind of wonder if Trump had been more successful in getting the vaccine rollout in place, if that would have happened quicker, would that have been a salvation for him? Maybe he would have won a second election, who knows? But I think Boris Johnson realized very quickly that what we needed to do was to have a very successful vaccination, a world leading, as they keep on telling us it was. And in many ways it was a hugely successful moment. And I think in some ways, there is an interesting sense of a buy-in to British national identity on that level. It was Oxford AstraZeneca, the vaccine. This was how it was always referred to in the BBC and ITV and so on. And there was a sense of British pride in the fact that it was produced, yes, in conjunction with a European pharmaceutical company, but the research had been done here in the UK. And of course, as I say, very many people wanted to take the vaccine as well. I think those things are important. So we're in a very different space. But as Mardi mentioned in our early conversation, we're now seeing a slight turn. And I'm not quite sure. And Mardi, I think, could be dead right. She could have hit the nail on the head when she said maybe this vaccine lasts for 5 or 6 months, and then we see a huge weakening. Again, I'm not a scientist, so I'm not getting there. But I think boosters are necessary. We're seeing a good booster program here in the UK and in Ireland as well. So that's quite interesting. So hopefully, as I say, the vaccine doesn't stop you from getting COVID, but obviously we see the mortality rate is hugely lessened by having the vaccine. So that's a good story to come out of that.
Yeah. We're having a science panel, everyone will be delighted to know, on the 30th of November. So we will be talking to the Albany College of Pharmacy and different, epidemiologists and microbiologists and all kinds of things. Francis, Padraig just sparked my memory even of, last Christmas, of course, we couldn't go home. So we went to my sister in California and her husband, and we watched RT, which I can't get Irish television here unless I watch it, on the internet, but they have some, I don't know what it is, a subscription or something. And up in the corner of the RTE logo, on the TV screen, it said together apart or staying together. It was just this, I couldn't believe it, like that on the national television, there was this mention of the fact that we were working together, to stay healthy. I kind of thought, Francis, if you were a group like that, you were a community within a community, and maybe sometimes separate, like you have refugees from different parts of the world, that don't necessarily communicate. So how are those microcosmic communities faring, together or separately together?
in Albany, it was so efficient with the community leaders and the Albany County Health Department, because we were able to push the government to have a specific link and site to help refugees to do registration for either vaccine or testing, that one. And that was efficient because they could be, they were on accessible place, that one. And also there is different languages, but as you know, we had some people who are illiterate. They cannot read, they cannot write. So the school was a part of them to talk the kids, to tell the parents. And another, but there is some misunderstanding on the side of like there is somebody will come, they say, oh, doctor say that people who are pregnant, they cannot have vaccine. Who said that? When you go far, they say, oh, we were scared. So try to design some barriers themselves to not get a vaccine because they're scared. Other people what you were doing is to go with them. Let's go together with, or maybe my wife or my son, let's go get the vaccine. You see that he getting vaccine, he doesn't die immediately, because that's what people are thinking. So we're using different tools to make sure that they understand what's going on. Still, there are people who really don't want. Another factor was that people at work, as you know, in New York State, they ask all employers to use sick leave to facilitate people to get vaccine. To stay, I think it was 4 hours, something like that, to get paid sick leave. So those are kind of incentives that they were giving to facilitate people. And also, as you know, they also put the taxis to drive people to go to get vaccination or to get a test or to do this. Even our site, we called to get people who are interested to get vaccination. They can come to learn English. At the same time, they can get vaccination. Still, there are people who are resisting, but the number is going little by little go down. I'm not sure you answered your question.
No, that's fine. I think that's part of it. I suppose the isolation, just adds to the barrier, as well. And so, but Mardi, what then, we won't stay on much longer, I think, but what are the lessons, going forward, not just for, your own community, but what do we need to do? I think particularly because, I can't remember which one of you said it, but sometimes government is not working, and so if we could wave a magic wand and tell them, what our communities all need. Well, Leanne dropped off by accident. What would we need to do?
Well, I'm not even sure if I'm at lessons learned yet, but I appreciate you being so forward thinking, because we're still in the mix with it. I really appreciated what Leanne had said about her own family not being vaccinated. And I put in the link something that we've worked on, Cousin Earl, and it's kind of fun to find a little animal along. And so it'll be helpful at holiday tables to have some conversations without not being invited back at Christmas or something like that. So we're still working on some things to reach folks who are not vaccinated. The other thing, and someone, I can't remember who on the call had mentioned the radio stations and the other countries kind of zooming stuff or sending stuff over the lines into the United States. And we're having some faith communities send some things like the vaccine is the mark of the devil language. And so just recently we worked with a a lot of congregations, Jewish groups, Muslim groups, Christian groups, the Shambhala group, and to have a statement around compassion and being vaccinated. So we're still doing some things on that. One of the lessons learned is, I think you talked about it, is when we work together, big things can happen.
Yeah.
And that's one of the big lessons is it's not just the LGBTQ group, right? We are Black folks, we are brown folks, we are rich folks, we are poor folks, we are people of faith. And so when we all pay attention to our intersections, the possibility of improved public health is there for the taking.
Mm-hmm.
It is important that the government listen to us. It is important as leaders in our own community to get to those tables and to have the conversations. Mm-hmm. The one, bell that I'm going to keep ringing until it is done is we as a community have to be seen in public health data. Yeah. And I am a dog with a bone. And until that is done, I will not be carrying another bone, because it's important for all of us to have that data, for all of us to be safe. Whether or not you believe LGBTQ people matter, it matters to your health. Yeah. And the government needs to see that. So lessons learned, I'd love to come back in a year and see if any of us have figured that out. I'm not quite there yet.
Mm-hmm. That's a very good point, Mardi. I think, this pandemic, really obviously highlighted the huge inefficiencies, or inequities in the society that, absolutely, Padraig, as you said, some people could stay at home and it hardly impacted your life. You were working from home, you could still access all the food you wanted, myself, to be honest, I'm single, I live by myself. I was a bit worried the Friday that we closed it down, because I didn't know what lockdown meant. Was the National Guard going to be on the street? I went into work on Monday, I worked by myself at the museum at the time, so there was nobody down there. But my life didn't actually change, between, even though the museum was closed, I still got paid. In fact, some of us got stimulus checks. Life was kind of good in one way. And yet, Mardi said it, you're perfect, Leanne. You can catch it from anybody, it's an airborne or, droplets disease. And so just because you think the poor person who's stocking the shelves is the only one that's going to get it, you could get it, And so we have to all be treated the same, Leanne, talk to me about what, could we do differently or should we do differently, going forward, particularly to reach marginalized or skeptical communities?
I was going to say I had COVID. After my first shot. And so what can I do differently? I kept thinking, what on earth happened that I had COVID and was pretty sick, although I had a vaccination, one of the vaccines, and then I still contracted. So one of the things that I think we must do differently is I've been like the poster child for the rest of my family. If you don't want this, you have to get vaccinated, and be diligent about that with everyone you know. And that's the only way we know so far to help our families, to help, our community at large, help all the people that we possibly can. We've got to be vaccinated. That's really hard to swallow for some people in our communities, and our Native communities have very long memories. Thank you very much. I know what they did to us. Our history is that the government rolled people in the dead with the smallpox victims and then traded blankets to them. That story is on the lips of every Native person in this country. I'm talking about the US. And so it's very hard, but by the same token, I strongly believe in science. I also believe that this is something we can do, and be a spokesperson to the people around us. Even though I got it, I had a much lesser, I wasn't as sick, and I didn't die as some of our people have who refused to get vaccinated. And so that's been my mission since I recovered in by around the April. I began to get better, but it wasn't for lack of trying to get vaccinated, but I've tried to then use my voice to influence all the people around me. This is something that we all need to do. And it won't save us necessarily from getting COVID, but this vaccine will help us weather that storm. And I'm the poster child for that. And I'm very happy I did that. I'm also really happy that our families have been vaccinated. And it's a scary thing for my children to say, oh my God, my mother has COVID. And it helped them get out and get vaccinated, and their children. So I have grandchildren. So I think, what can we do different? We also need a lot of training about disease, pandemics, everything from the measles, everything that we do. I mean, we all used to, and I'm rambling, we all used to just line up for vaccines. People don't do that anymore. They're very hesitant, and it's our history. They read about it, and so we have to overcome some of our fear. And that's through education and educating ourselves in what's happening in science and the federal government in the US and the federal government.
I suppose, Padraig, the messaging maybe could have been better from government sometimes, and I would say a little information or a little knowledge is a dangerous thing. Like if I heard one person say like, oh, I've done my own research. Oh, so you spent years in a lab, like with epidemiology and slides and microscopes. Reading articles on Facebook is not research, particularly with the medical or the science. Maybe you could cobble together a history PhD, by doing that without going into an archive, but you can't. It is not the same thing, and so how do we combat that level of kind of ignorance, like that they think there's information out there that they're gathering, but it really is not information?
And so interesting. I mean, I'd just say two things. I mean, first of all, the fact that Leanne Howe has had COVID and is now telling people to, I mean, it proves A, that woman is tough, and B, I can tell you, she's very persuasive. So I'm sure many people have been vaccinated thanks to Leanne Howe. On a lighter note, but no, you're dead right. And I mean, this is such an interesting question. And I think Mardi touched on it earlier on. One of my best friends from home, who I've known for 25 years and still see regularly, is unvaccinated. And we've spoken about this. And I think in some ways, when we see the political response to what are very often kind of wedge issues or complex issues in society today, that's so disappointing, because as Mardi said, and she's dead right, we need to have these conversations. As Leanne said, these are not people who we need to demonize. These are not people who who have kind of ridiculous thoughts at all times, but they have hesitancies, and they need to, we need to have open and frank and honest exchanges. And I think that is one part. And one thing I've noticed here in London in particular is that in each borough we've had a number of vaccine advocates and people from various communities, and Francis will probably, something that might chime with him, as you're saying, some of the challenges around, for instance, even just kind of leafleting in various different languages for different communities. So the importance of having different vaccine advocates from different communities, all of whom can, speak to people they know and look at the particular challenges. And again, this is something that Mardi mentioned too, that sense of invisibility. You know, if government seeks one constituency because it votes in a particular way, that's so dangerous, because that, you know, it ostracizes, and it also keeps so many people quite literally in the dark by times. And you've touched, Elizabeth, I think, on that really wonderful question of atomization, I suppose, within society. And I think in some ways, obviously, it's very often social media driven. And quite often people are disappearing down a rabbit hole. They're reading stuff, as you say, content on Facebook. And to go back to my own friend, and you know, I'm not sure if he's watching this, maybe he is, but I remember having a conversation, and there was a really well documented, you know, tragic case in Ireland where a young woman in the north of Ireland who was pregnant, in the very late stages of her pregnancy, contracted COVID and passed away, and the baby was delivered by a cesarean section. And in a really kind of heartbreaking scene, they had a christening of the child and the mother's funeral on the same day.
Oh.
And I remember talking to my friend about this, and he hadn't heard about it. You know, he this was a story that he had not come across, and yet he was able to tell me, you know, and again, these putative stories about things that were happening by people who've been vaccinated, and things were happening to them, all of which were generated on social media by unsubstantiated sources, and so on. And I think that's the danger. I think when we lose, I think Leanne and I've spoken about this before, when we lose that kind of community spirit, when we lose the ability to talk to one another, and when we begin to reconcile the other party to either, you know, hard right or hard left, then I think we kind of, a lot of common sense in some ways, and a lot of trust, more importantly. I think trust is the main thing. A lot of trust disappears. So I think it's building up that trust. It's having these conversations. And the good thing, I suppose, is and you know, the irony being me giving out about social media, but all the way through the pandemic, I've seen more of Leanne Howe and various other collaborators, because we've done this. We've had conversations globally, and that's been a huge silver lining, I think, throughout this. And so again, thank you for having us here tonight. And these are the wonderful opportunities we now have, I suppose, in the modern world. And you know, hail Zoom.
Yeah. Well, absolutely. You know, to be honest, it kept the museum going too. Obviously, nobody could come in the building, you know, and so we had to we had never, I mean, it's funny, you know, now we do everything online. We had never recorded our talks before this, you know, and now they're all recorded. It's amazing. Yeah. So I'll just give Francis the last word, and then I'll ask people that are on the platform here on Zoom, you can type a question into the Q&A section, and I'll you know, deal with them, or YouTube as well. I think you might be able to type in the comment section. But Francis, have you any last thoughts for us? And you just have to unmute.
What I found also kind of, I don't know who the weakness is to have, I have been bringing parents to the, you know, when the child maybe was exposed to COVID, and parents have been bringing kids to for testing. I never seen maybe in the testing center asking parents if they are vaccinated. So I found that is an issue, because that if maybe in the vaccination center could ask the parents, could motivate the parent to get vaccinated.
Yeah, yeah.
Another issue I found out that in school, of course, there is some schools guidelines sometimes are not clear enough to the community. Let's say, you know, a child was exposed, they say either you go to test or stay home for 10 days. And so the child say, I'm in quarantine or I'm not. So still those confusion are there. And I don't know how, I've been talking to school how we can overcome in order to make clear. And the other ones, they do not accept rapid tests in school. That has been really, really hard for our community to understand what's going on. Yeah.
You know, I suppose, you know, we could be here all night, and I am, as I say, it's open now to questions, so anyone type in your question. But my father says common sense is the least common thing, and that, you know, I think that's what we're kind of finding out really, is that even small practical measures, like what if we all had the same standards across the, like either that rapid testing is or isn't, or, you know, it's very difficult to think that there is these levels of different, you know, you can come into my building with no mask, or you have to be vaccinated to come into mine, and maybe, you know, maybe there's nothing wrong with having one level. And I would say wear your masks. So while I'm waiting for the questions to come in, I'm just going to remind everybody, thank you. You know, this was fantastic. It's our inaugural event for this program, which is, as I say, the Communities for Immunity, which is being led by the Association of Science and Technology Centres, the American Alliance of Museums, with support from the Centre, the CDC, Centre for Disease Control and Prevention, and the Institute of Museum and Library Services, with about 5 or 6 other museum and library organizations. So we were absolutely thrilled, you know, to be part of this pilot program. On Monday night, we are having Dr. Karen Sonnenleiter from Siena University here, Siena College in Albany, to talk about actually the famine, Irish, the Great Hunger, refugees, and how Irish fever was ascribed, you know, to immigrants. So that's called History in the Pandemic. And then on the 30th, we're having, as I say, our Science in the Pandemic panel. We are also running, we're delighted to say, a vaccine clinic on the 20th, which is a Saturday. John MacDonald and Mara Pharmacies from Cohoes are coming down to give flu shots, but also boosters and your first shot if you have not yet been vaccinated. We're finding out whether he will have the children's vaccine, because we know children from 5 to 12 have been approved now. So there's a form, we put it in the chat, but if you go to our website, irish-us.org, or our Facebook page, or all of the social medias, it's pinned. There's a KELA form that you fill out, but you can drop by the clinic on the day too. You don't have to sign up. So we're thrilled with you guys all, and I'll just check. Nobody has a question yet in the panel. I better scoot over to YouTube and just see if anybody asked a question over there. Let me see. Sorry, I think we're okay for a second. So, and actually, sorry, Mardi, I wanted to push that. Mardi put up on the chat here, and I'll share it, Mardi, on our social medias tomorrow. Yeah. A fantastic Cousin Earl, you know, what to say when you're confronted by somebody without, you know, ripping the head off them, or so that you can still enjoy Thanksgiving. I was very impressed by it. I thought it was amazing. So yeah, somebody just wanted to know a little bit about the Cousin Earl, so we'll share that. But it does help you to try to diffuse the situation, and Padraig, you touched on it too, that, you know, this is not supposed to be something that's combative, and particularly I think here in America, and God knows as an immigrant I don't like discussing politics too much, we have lost, I think, the ability to talk maybe to each other, because we are so siloed a little bit. And so, you know, maybe you tend to be dismissive of somebody that you think, you know, has a different viewpoint to you, or is coming at it from a different angle. And so, you know, Padraig and Leanne, you all have touched on it. We need the compassion, you know, to be able to speak softly to people and reassure them, you know, that there is nothing nefarious going on, you know, that Bill Gates is not implanting anything in you, you know. So I don't think we've any questions. I'm checking everywhere. And I know it's been an hour. No, I think I don't want to, you know, shut you all off. But so Hannah says, thank you so much to all the panelists. This was fascinating and inspiring. I think it was amazing. You know, I could stay on for 2 hours, but Padraig, it's 1 o'clock in the morning for you over in London. So thank you guys so much. I really appreciate it. If anyone, you know, that's watching the video tomorrow or whenever has questions, all of the, certainly Mardi will link with you. RISE here in Albany, it's RISSE. We've partnered with the food pantry, you know, we've kind of dropped off flyers for the vaccination clinic around Albany. So there's plenty of information out there. And if anyone in Albany or the area wants to drop into the clinic on the 20th, they absolutely are welcome. So thank you all. Keith says thank you.
What an honor. Thank you. It's nice to be with you panelists. Thank you so much.
We will check in.
See you, Padraig.
Yeah, thank you. And I'm glad you're healthy, Leanne, you know. So everybody stay safe, wear your mask, and we'll definitely be in touch to check in on everyone in a couple of months' time and make sure you're all still good. They're all saying thank you so much, you know, that they've had a great time. Okay, so thank you, everyone. God bless.
Bye-bye.
Good night. Take care.
Bye-bye.